Hello, everyone. I'm so excited to get to spend a little bit of time with you today to talk about a topic that's really important to me and something that I see and utilize every single working day, and that is telehealth. Telehealth truly is critical to expanding access to care and accessibility for all. When you think of telehealth and you think of the advancements that it's had over the last, say, 4 years with the COVID pandemic, it is incredible to see the amount of patients that we are able to support and care for from afar while still advancing and growing the medical fields in so many different specifications and departments that tie into overall health. I'm going to break up the presentation into a few different categories or topics to be able to really dive into why telehealth and, in my specific field, teledentistry is so important. So first off, I'm going to define telehealth. Telehealth, telemedicine, you hear these terms intertwined quite a bit, but I'm going to define what it is so we can really understand how it makes an impact for our society and for patients' overall care. Then I'm going to talk about the history of telehealth. Spoiler alert, it didn't start when you think it did, when you thought it did. So I'm going to dive into how have we evolved over time and where are we going with telehealth. Then it is important that we dive into some of the legality of telehealth, some of the regulations that are put in place to protect not only the patients, but also the providers. So we have to dive in and understand what specific rules and laws come into play in regards to telehealth. And then, of course, the big tide changing turn in telehealth and the fast pace, quick start. How do we get as many people utilizing telehealth with the COVID pandemic and the impact that it had, tying into some of the direct experience that I had being a newer manager in the dental field at the start of the COVID pandemic and navigating how do we adapt to telehealth, specifically in a very hands-on, patient-focused profession. And then I'll talk about some of the current literature and news surrounding telehealth and how you personally can impact telehealth or utilize telehealth to your advantages. We'll finish with a few discussion questions, and then of course I'll go through my works cited. So in order to really understand telehealth, we have to define it. And telehealth is defined as the distribution of health-related services and information via electronic information and telecommunication technologies. Now that's a mouthful. What it really means is the ability to offer remote clinical services, the ability for constant contact, and the quick click of a button understanding of your medical chart and having access to messages and former test results and just seeing everything at once within an app or on a secure website. So let's talk timeline. Healthcare at the click of a button, or back in the day, 11 buttons for a phone number. Telehealth started in the 20th century and has continually increased as technology has become more and more developed and accessible to all. So some of the first telehealth type usages that we've had was back in the 1960s when we were heavily investing in the space program. In the 1960s, doctors and specialists would be able to communicate and support the astronauts by checking their health levels and communicating via the earliest form of telehealth. And if we think of the more traditional sense of telehealth, it came in the 1970s at the University of Nebraska. Pretty cool, huh? So they started the whole process of initiating phone call conversations between a doctor and a patient, and how can we do that to be able to provide access to care to more across the country. It is really important for the sake of this timeline to know that in 1996, one of the most common legal tie-ins to the healthcare profession, HIPAA, Patients' Right to Privacy, was officially established. So this ties in directly to telehealth and information systems because we have to make sure that any type of telecommunication or portals or platforms that we use always have very, very top standards and top of mind focus on maintaining HIPAA or patient privacy. And then lastly, this image here represents the impact that the COVID pandemic had on telehealth and the fast pace adapting to, just like in many other professions, how to be virtual and how to get the most done and be able to keep business as usual, take care of patients, take care of clients in an effective way when we were limited and not able to see as many patients or not able to go into the offices. So this COVID pandemic really kicked things into gear with telehealth and really sparked a turn that we are still being able to utilize and benefit in today's environment. So to really dive into telehealth, we do need to understand the legality of it. It is important to note that state by state, things can change. In Ohio, through the end of the year, so until December 31st, 2024, patients are allowed to have their initial mental health visits via telehealth. This is something that's been up for debate. You can hear many different perspectives on it, on if telehealth is an appropriate substitute for inpatient appointments. But in the state of Ohio, through the end of the year, and this is something that we'll have to stay close to because who knows what's going to happen next year, but patients are allowed to establish their care with their initial visit via telehealth. It does vary. So in 50 states and Washington, D.C., live video streaming or live video feed with your doctor or your provider is allowed. And by allowed, I mean it is something that is regulated and that the insurance would deem an appropriate appointment and pay for your services. But it does vary depending. So 37 of the states, they will allow remote patient monitoring without that video feed, but then there's still 13 others that don't. And then there's 43 of the states, including DC, allow for audio-only telephone dentistry. So you don't physically get to see your doctor or your doctor's not physically seeing you as a patient. Now, keep in mind, too, with telehealth and teledentistry, there are certain things that you can't do from home or you can't do remote that have to be done in person. Depending on the severity of your health need, your doctor always reserves the right to have you come in for an in-person appointment. But there are so many advantages to being able to be virtual and have that initial screening or handle something like if you are experiencing, in the dental world, extreme sensitivity and you have an abscess. There's not much we could do in the practice other than prescribe you an antibiotic, allow that to kick in, and then perform whatever type of dental services are needed, maybe a day, 2 days, 3 days later. Each doctor is a little bit different, but if we can stop that step and not have to have you come all the way into the practice and be able to perform that via, Zoom or WhatsApp or Microsoft Teams, whatever platform the doctors use, it could allow for limited time in the office. It helps get more patients seen. It also allows you to work things in your schedule so you're not having to take a whole day off of work or a whole half a day off of work. There are so many amazing advantages to telehealth and teledentistry, specifically in my field, that it is very important we stay close to it and evolve as technology and as things have changed from time to time. We need to make sure that we are always investing in these type of services because it can benefit so many people. 2020 really was the turning point for telehealth advancements. We got into a point where we needed to find a solution right away. I know from working in the dental field, and I had worked in the dental field for about 5 years prior to the start of the pandemic, that we could easily make a difference. The particular DSO or dental service organization that I worked for had offices just about 1,000 coast to coast. And depending on the state, there were different regulations on if you could be open or not. But one thing, speaking of dental, that's extremely, extremely important to note is tooth pain is the absolute worst. And in the middle of the pandemic, when dental offices were closed or seeing emergency only visits, it didn't magically stop dental needs or tooth pains or abscesses. So in order to prevent patients from going to the emergency rooms that were servicing patients with COVID or much more severe needs, being able to adapt and modify and offer telehealth visits really allowed us to care for a lot of patients, and it allowed us to limit the amount of patients that were going to the hospitals. A side bonus from that is due to the fact that we weren't seeing as many patients in the office, we were able to sort of streamline our staff and allow people to stay home and rest and recover, and anyone with any type of health concerns or family members with health concerns that didn't feel comfortable being in the office were granted that ability to work from home. But we were also able to donate a lot of the PPE that was really hard to come by at the start of the pandemic. And in some cases, things are still difficult to get, but that we were able to donate that to the hospitals and the emergency rooms that had a higher need. And we could still service patients virtually. We were able to triage. We were able to book a schedule where we had maybe one assistant, the doctor, and one person up front working, so 3 people out of normally a staff of 15, and be able to offer services in office to fix problems or to treat emergencies, but we could triage virtually and the doctor could still see patients throughout the day, the same number that he or she would have seen prior to the pandemic, just only one column or about 9 patients per day were actually in the office. This allowed us to also, now we always sterilized and we abided by JCO standards, so top-notch hospital grade sterilization, but this also allowed us to use less of that PPE, take our time, double, triple sterilizing, making sure everything was absolutely set up and perfect for the next patient, changing gowns, changing PPE, getting some fresh air, and just breaking up the visit for the patients, but also for the staff that was in office. So I got to speak with you a little bit already about my personal experience in the dental field in 2020, but these are some statistics. Now, telehealth is not just teledentistry. It spans all across your standard healthcare from a medical practitioner to mental health to counseling services to so many different great aspects that allow us to get the care that we need. But when you think of it from a dental perspective, this is very interesting seeing some of the statistics in the dental field. 36% of dentists believe COVID-19 allowed them to learn more. So in learning more, we learned how can we be more effective as providers? How can we care more for patients? The portion that I really want to draw your eyes to is that 22% of dentists believe that there are new opportunities that have emerged in the midst of the pandemic. And I know that it's not just dental. I have friends that are other specialists or work in other specialties. I've talked to my personal doctors, and it is very engaging now since 2020, having access to a patient portal or having information right at your fingertips. I could message my doctor. I had a son in 2022, and it was really great having the ability to message him with quick questions instead of having to wait, leave a voicemail, determine was that an emergency to wake him up in the middle of the night, or is it something that could wait till the morning? Play phone tag back and forth. It was so nice to be able to send a quick message or find frequently asked questions and be able to see specific doctor-approved answers to help point you in the right direction. Overall, quality of care has improved so much. There's a lot of information in current news and literature regarding telehealth. One of the main things is that as a state in Ohio, we have allowed for extended time for initial appointments from mental health professionals virtually until the end of the year, meaning if you need the support from a counselor, a therapist, a psychiatrist, a psychologist, you can have that initial appointment virtually until the end of the year. So mental health is a big piece that we're able to support with telehealth. Also, rural accessibility to care. So if you live somewhere rural where it might take you an hour, hour and a half to get to your provider, it's much more difficult to get there, especially with the rising cost of gas and needing to take time off work to spend a whole day in the doctor's office. It's so great that we're able to provide care to these patients with telehealth. How does telehealth impact you? So you definitely want to understand the advantages to the option for telehealth. Now, if it's not the right fit for you, that's okay. A lot of doctors offer patients to have that choice in their care and how they want to schedule their appointments. But when you're newer in the workforce, or if you have a pretty hectic work schedule like I do, it's very difficult finding time to take time off to go to appointments, especially if they're routine or preventative. So being able to schedule a telehealth appointment and do it from my car and step outside of an office or over my lunch break really allows me to get seen sooner and not have to make other arrangements. Side note, it also allows your PTO to be used for enjoyable, fun items instead of having to take time off to go to the doctors. I would encourage everyone to spend some time looking at their compensation package that's offered as an employee because there are so many other benefits that a lot of companies, especially since the pandemic, have really started investing in. A lot of companies, including the last 2 that I've worked for, have allowed and provided virtual support, complimentary virtual care for things like urgent cares. So if you feel the need to go to the urgent care, instead of having to go to an urgent care, you can log into a third-party portal and they will support you and answer any questions that you have. In some cases, provide an antibiotic for you if that's what you need, and you could go pick that up without having to actually go into the office. And I don't know about you guys, but it never fails. Whenever I go to an urgent care, I always leave and feel sicker throughout the week because I'm in an environment where the lobby is just full of people that aren't feeling well and looking to get help. So that prevents that. You also might have access to quite a few other perks, such as mental health support or counseling sessions that are all included. A lot of companies offer 5 to 8 per year at no additional charge to their employees. And it's not just for you, but for your dependents as well. So you want to see what type of benefits that you have, and make sure you're asking that if you're on the job market and you're searching for that right position. These are wonderful perks that a lot of companies offer that not everybody knows about. So you definitely want to ask and talk about it. So speaking of talking about it, here's some questions that I want to spark some conversation and see what everyone is thinking. My first one is, what are some things that we can do to help raise awareness of telehealth benefits and advocate for continued investment in these services? The next question would be, have you personally ever had an experience with telehealth? What did you enjoy about the process? What could have been better? Side note to that, how has technology evolved since? How can we use the continual advancement of technology to better offer these telehealth services? And then a bonus question, is there an age group or population underserved regarding telehealth? And what can we do to support this group? How can we help get them access to telehealth care? And finally, if you want to do a little bit more research, there's so many great tools out there regarding telehealth. These are the ones that I use to prepare this presentation.